You're watching the Randy and Christa Show. I'm Randy Alvarez.
And I'm Christa Orecchio, and this is news that makes you healthier. Today's show, Randy, is for women 40 and up, perimenopause and menopause. We have Dr. Melinda Silva coming on the show, which you've interviewed before.
I've interviewed her. I met her at the biggest conference of its kind, the American Academy of Anti-Aging Medicine.
Okay.
So she's good. She's a Fox contributor. You were on the Doctors the same day she was on the Doctors?
That's how I met her. We were on the Doctors the same day, and then she also does a weekly segment with our local Fox affiliate. And just talking with her a few weeks ago, and she said, you know, she's been a board-certified family physician for 16 years and really wanted to move into the hormones and the endocrine system. And I love her approach. So she did a fellowship in functional medicine. She's a regenerative medicine specialist. So we're going to talk about weight loss when nothing else works. You know, when you get the belly bulge in your early 40s through menopause. We're going to talk about graceful aging, not anti-aging. And just I want our viewers to really understand hormones in a different way today.
I talked to her in the green room, and one of the things that she points out, this is like the new aging gracefully. That you could either take advantage of modern medicine, what they know about bioidentical hormones, or not, right? It's not for everybody, but it's worth looking at. And she's into nutrition too, like you.
Yeah, she's into lifestyle, fitness, nutrition. You can't be a health practitioner and not focus on those things.
You have a big following. What do your people want to know about bioidentical hormones? When you interview her today, what are you going to get from her?
What they want to know, because you can use synthetic hormones or you can use plant-based hormones. And so I want her to drive the point home for those. And then also it's so sensitive. So I get the question a lot, like, so how do I know how to customize a dose for myself? And then if you start healing, should you stay on that same dose? So if she can lay out a plan for our viewers and for my tribe today, I think that would add a lot of value to them.
Okay, good. We're going to go to that interview right now. You're watching the Randy and Christa Show. We'll be right back.
Welcome back. You are watching the Randy and Christa Show, news that makes you healthier. I'm Christa Orecchio, and I'm very excited to introduce you today to Dr. Melinda Silva. She is a medical doctor and also functional medicine doctor and healthy hormone specialist. Welcome to the program, Dr. Silva.
Oh, thank you for having me. I'm so happy to be here.
Yes, you are my Fox 5 cohort.
That's right.
And I'm so glad we ran into each other again and that we could have you here because I love what you're doing.
Oh, serendipity.
It is serendipitous. And we're going to help women today that are perimenopausal and menopausal. I'd say anywhere over 40.
Yes.
I want to talk hormones and figure out how to holistically help these women to lose weight. And I love how you say age gracefully.
Right.
So give me kind of broad strokes umbrella of how do you help women in this category? Which hormones do you look at first, and how is this a holistic process?
Well, for me, it started with helping myself. I started having hormonal changes when I was about 47. I had my fourth baby when I was 40 years old. Okay. And I was having issues with sleep and energy and mood and stamina. And when I went to my own doctor, the treatment was birth control pills and Prozac. And I knew that that wasn't going to be what I wanted to do for myself, because as a doctor, my focus has always been prevention and doing things more naturally. So I looked outside of mainstream medicine and I found out about bioidentical hormones, and it changed my life. I mean, I remember having that midlife belly bulge and just not feeling pretty and not feeling good and just feeling tired, and knowing that I could do something to help that wasn't going to hurt me. I didn't want to take any prescription drugs. The synthetic hormones, you know, have increased risks of heart disease, cancer, and stroke, and I didn't want to have that. So the bioidentical hormones not only gave me my life back, but it helped me to be on a path of wellness and health.
And you
that
can
makes me
then
stronger.
pay it forward.
Yes, for sure. And now I can help people who have the same issues, you know. So I focus quality of life, sleep, energy, sex, stamina, weight, mood, the things that we care about. You know, as my husband says, when mama's not happy, nobody's happy.
Yes, there's a lot of signs about that, isn't there? So, okay, so at 40, fourth child, now you've got to, I mean, your body's been through so much at this point. You're a doctor, you're a mother of 4, and you're depleted. So where did you start? Like our viewers in the same situation, where do they begin?
Well, I just want to make sure that people understand one of the reasons why your weight fluctuates is because your hormones are fluctuating.
Yes.
Between 20 and 30, most people stay the same weight, right? Because your hormones are pretty stable. After pregnancy, after 40, the closer you are to menopause, the hormone fluctuations cause weight fluctuations and also decrease in metabolism.
Yes.
The hormones that are really important for that are the thyroid hormones, estrogen, progesterone, and testosterone. All help to keep you healthier weight or make you gain weight. So it's important to have those in balance.
And it's body composition as well, right? I hear women a lot in my practice say, I'm getting more cellulite, and I never had it now in my late 30s and early 40s.
Oh, I hate cellulite.
All of us
That's
do.
like the vein of our existence. And any woman can get cellulite, whether or not they're overweight.
Yes.
There's one statistic that says 90% of women at one point in their life will get cellulite.
Yes.
So cellulite happens when there's the fat cells that are kind of in disarray under the dermis layer, and there's decreased collagen there. So it's going to be in women more common in the thigh area or the buttocks area, and a lot of the times that is that way because you're not moving as much. So women postpartum after pregnancy, so they're not moving around as much. The circulation is less in that area, and so the pockets of fat can stay there. But women that are not overweight can also have cellulite issues. So it's a disarray of the collagen and the structural integrity of the fat and the collagen in that area that causes the dimpling and the very unsightliness of the cellulite.
Is there also a hormonal component of low testosterone?
Most definitely.
And then more cellulite showing up?
The research shows that when women don't have enough testosterone, that the cellulite is more predominant. And unfortunately, as we age, women are going to lose testosterone. It's a myth that women don't need testosterone. When women stop producing estrogen and progesterone, they also start producing testosterone.
We become
and we forget
depleted.
about it, right? And that can cause the propensity of the cellulite to occur.
Do you have a patient story that you're thinking of a woman after she's giving birth and she's depleted, and did you put her on testosterone and really start to see positive changes, not only in weight and cellulite, but in energy and that get up and go to be able to re-enter life after going through such a journey?
Yes, you know, I saw a patient the other day. She was on her third child. She was in her mid-30s, and she did not feel like herself again. After the 2 babies, it was fine, but for some reason, her third baby just zapped her all of the energy. And she was kind of reluctant to start on testosterone, but her testosterone was really low. She was on birth control pills for many years, and a lot of women don't know that birth control pills actually deplete your testosterone levels. And the problem with her was that she had really low libido, and her husband urged her to come in to be seen because he wanted her to feel sexy again. Testosterone for women also gives women that edge. So she didn't have motivation. She was apathetic. She didn't really have the oomph for life. So really she just wanted to feel like herself again. So we started her on progesterone and testosterone because that's what her lab levels showed. I never start people on hormone without checking what the hormone levels are.
Absolutely.
And hers were really low. And what happened was that her progesterone was low, which caused her to have more of a belly bulge. So it was harder for her to lose the weight. And her mood was low and she couldn't sleep well.
Yes,
So
the
I knew that,
trifecta.
yes. So that was because of her low progesterone. The low testosterone not only decreased her libido, but it also decreased her muscle mass and her motivation. So a few weeks after she started on testosterone, her whole life turned around. I mean, she was able to play with her kids, you know, have energy for them, and be intimate with her husband again, which was important, you know, for their marriage, but then also do things for herself. As women, we do so much for others that sometimes we forget about ourselves. So I'll have women tell me, you know, I just have just enough energy to cook and clean, get the kids ready for school, but then they don't have time to do the things that they enjoy, you know, like their own exercise routine, whether it be yoga or dance or whatever fulfills them. And I always tell people, when you're happier, you're always going to be a better mom, a better wife. So the testosterone for this woman gave her that energy to get through her day, but then she was able to exercise, which we know is going to increase muscle mass, is going to keep her bones strong, is going to keep her mind sharp because there are testosterone receptors on the brain, is going to make her more intimate with her husband, so everything at home is better. And it just totally turned her life around. And it was not, I didn't give her anything that was harmful or was going to be dangerous for her, because I always do physiologic doses. I don't ever do anything that's going to be too much.
And okay, so let's talk about the physiologic doses, but I also, if you could show me the difference between synthetic hormone replacement and natural bioidentical, like help us understand those two tracks and where that's come from.
Yeah,
Because how do you know when you're interviewing a doctor and you want to get your hormones balanced that you're doing the right thing for yourself?
So make sure that the doctor that is trying to give you the bioidentical hormones, they're credentialed, that they've studied, that they really know what this is. There are some people that just take weekend courses and they think that they could give you bioidentical hormones. It's much more than that. I actually did a fellowship. So 2 years after I trained from being a medical doctor, that I just studied the hormones, right?
So
and the
complicated.
bioidentical, yes, it's very complicated. The bioidentical hormones are different because they're made from plant sources. I prefer the ones with yam, made from plant sources, and they're made to look identical to the hormones your body makes. So they're chemically identical to the hormones your body has. The synthetic hormones look nothing like what your body makes. They have similar traits. Premarin, which was the #1 synthetic hormone in the world at one time before the Women's Health Initiative showed that it was dangerous with its use with Provera, that comes from the urine of a pregnant horse. You know, that's not anything like what your body
in
makes.
our bodies, right? Yeah.
So obviously it makes sense that your body's going to have side effects. Unfortunately, patients are confused because their doctors tell them a hormone is a hormone because they don't know that there's a difference. And it's not that the doctor is not trying to help you, they just don't know how to help you. When I went to medical school 25 years ago, I didn't know about bioidentical hormones. So I told the patients, don't be mad at your doctor because they don't know about bioidentical hormones. They're just not trained in it. So just if you want to take the bioidentical hormones, go to a specialist, somebody, that's what their training is, so that they can treat you the right way, because you should have lab analysis. They should be able to treat you. It's very personalized, the treatment for bioidentical hormones. So you can't just take the hormones willy-nilly, because it can still, too much is not good. You know,
It's
too
like,
much
well,
water,
they're all
right?
Goldilocks hormones, right? It's just the right amount, you feel great, too little, too much, and you notice. So, okay, so you'll run a lab, and then I imagine you work with a compounding pharmacy, and the physiologic dose is geared specifically to where they are in the moment. They'll start taking one or more of these hormones, and then you suggest lifestyle changes and then retest them 6 to 8 weeks later?
I tell them that the hormone is like a plant seed, right? So if you can imagine, that plant to grow needs soil, sun, and water.
Yes.
So for the hormones to work optimally, they need good exercise, good nutrition, and good sleep. So all of those lifestyle interventions just help the hormones work better. So it's not just about taking the creams or the pills or the pellets or the shots, whatever, and then magic is going to happen and you're going to be healthy. You still have to make the right choices.
Yes.
And I can't stress enough how important it is, nutrition and sleep and exercise. And that's part of the regimen of being healthier, having all those things in place, right? It's not separate in a vacuum. One thing is all that it needs. And I tell patients that because I don't want them to be misled, right? You know, I don't have a magic wand that's going to say, okay, you take these hormones and everything's going to be better. It helps, but they still have to do the work to be at the best health and be the best version of themselves.
Of course. I think that's probably the key, is to set expectations and personal accountability and responsibility right away when someone comes to you. And now you outline everything in Aging Gracefully and Strong, right? The diet, the lifestyle, and the exercise that you should do concurrently with your hormone replacement.
Yes, for sure.
Okay, that's wonderful. Okay, so we were talking about testosterone, and I find this really interesting, the role of low testosterone and osteoporosis. Because a lot of women, they're saying, I'm alkaline, I'm eating alkaline foods, I'm taking my vitamin D, I'm taking my calcium, magnesium. Why am I getting osteoporosis? So can you talk about the link between low testosterone and osteoporosis?
Yes, most definitely.
Okay.
A lot of people don't think about testosterone in women. But if you look in a skilled nursing facility or a nursing home, you will notice that most of the people that have hip fractures or osteoporosis are women, 9 times out of 10. That's because men have 10 times the testosterone that women do. So when women actually get replenished with testosterone, then it will help the osteoblasts in their bones to grow their bone and keep their bones strong. So there's a definite link with testosterone and bone health. So I tell women that it's really important to make sure that you're at normal physiologic levels. The problem is with menopause, those levels decrease. So you need to replenish enough so that you can keep strong. You don't want to overdo it. You don't need too much. Too much of anything is not actually good, but you need enough so that your bones can stay strong. And I'm afraid of osteoporosis because it affects Asian women more and women that are shorter and thinner. So I don't know if you knew that. So for me, I remember my grandma always hunched over, and my poor grandma, and I used to think, oh my God, I wish I could have helped her. And you know, there's not a lot of options for women, but one thing that's very easy to do is to make sure your testosterone levels are normal. Because not only will it help with osteoporosis and keeping your bones strong, it'll help prevent dementia. There's testosterone receptors on the brain, so it keeps your brain sharp. It keeps you having too much weight because it helps with your lean muscle mass. And if you have more lean muscle mass, then you're going to have a better weight because then you're not going to have as much fat. So all of those things contribute to having a healthier body.
So would you suggest that a woman who's low in testosterone, I mean, some women can be on it for the rest of their life after perimenopause or menopause?
Right.
And then they just consistently, how often should you get tested to see how your levels are fluctuating to adjust your dose?
Well, I test people at least every 6 months, so twice a year, just like going to the dentist, right? Because we're just going to do maintenance. So if you check twice a year, then we can make sure that your levels haven't fluctuated, because your hormone levels don't stay stagnant. It's a very dynamic process. So it's going to change, ebb and flow, depending on life factors.
So much.
Because stress and physical ailments, emotional distress, all of that affect your hormone levels. So that's why it's important to make sure that you have a good balance. And the only way that you really know is if you check.
Yes, thank you. I always say, don't guess at it, test it. And we're in our, I would love to talk with you actually all day about this. We're in our final few minutes. So my takeaway is for our viewers you must always check your thyroid. All 4 thyroid hormones, guys, not just TSH.
Right.
And we'll check our testosterone, we'll check our estrogen, we'll check our progesterone. And if we need to supplement, it's with plant-based hormones, finding a specialist, testing at least every 6 months. Is there any other takeaway that you would have for our viewers? Anything that you want to leave them with estrogen? A lot of people get confused about that.
Well, there's a lot of environmental influences that have caused women and men to be estrogen dominant. So you just have to be careful of what you put on your skin. You know, a lot of things that have parabens in it can increase the estrogen level and cause you to be estrogen dominant. Even the food that we consume, you know, always choose organic whenever possible. The meat that we eat, it's better to have a more whole food, plant-based diet. That helps, especially as we get older, because there's a lot of environmental toxins that cause us to be estrogen dominant. And that's not good for either men or women.
Right,
and
especially with breast cancer on the rise in 1 in 8 women.
That will increase your risk of breast cancer as well. Not to mention it increases your risk of diabetes because you have more insulin resistance, and then you get the midlife belly bulge, and nobody likes that.
No.
So just for all of those reasons, just coming from a place of health, just look at the things in your environment, and make wise choices about the food that you eat and what you feed your family.
Excellent advice. And your practice is in San Diego?
Yes, I practice in East Lake, which is right next to Chula Vista.
Okay.
Right off the 125, so it's very easy for people to get to. My practice is functional medicine. I am a primary care doctor, board certified physician, but I bridge the world of Eastern and Western medicine. I bridge the world of mainstream traditional medicine with functional integrative medicine. So I take the best of both worlds.
Yeah, well, that couldn't make us happier. That is why we started the Randy and Christa show. So
it's
thank
such a
you.
privilege for me.
Thanks for doing what you do, and thanks for being here. Excellent information. We'll be right back. Welcome back. You're watching the Randy and Christa show, news that makes you healthier. That was great, Randy.
It was good.
The biggest takeaway for me was I didn't ever really think about the connection between osteoporosis and low testosterone. And I think when women do hormone balancing, they kind of stay away from testosterone or they're afraid of it. And so that was really fascinating.
Now, women, she's talking about women over 40 and the commonly replaced hormones, thyroid, estrogen, testosterone. I asked her too. She said the testosterone's her favorite hormone. One of her favorite hormones.
Because it gives you the biggest bang for your buck. It's like, wow, I can exercise again, my cellulite's going away, I'm losing weight, I'm gaining muscle, I have energy, I have drive. This is how we all want to feel, especially when we get that dip, We've had some children, our hormones have been through quite a bit, and now we need to rejuvenate.
Now, one of the things, I learned a lot, I loved what she had to say, is that as you age, hormone levels go down.
Yes.
She talks about physiologic dosing. That means returning their levels to where they used to be. And according to her patients start acting young again.
Yes.
They're happy again.
Yes.
So now in your clinical practice, this must be a big topic. Everybody must be asking you about hormones. Like, who do I go to? Who's the go-to doctor? She's one of the people that you endorse.
Yes, and I'm so glad to be reconnected to her because a lot of the people I endorse, their practices are getting full, they have a wait list, and so I'm always looking for good functional medicine practitioners that I trust because I will help them heal their adrenals and get their thyroid on track, but I don't really touch the sex hormones. And I think that that's key is understanding how to use that physiologic dose. Like she was saying, you interviewed her, it's like if you have to get from here to LA, but there's only enough gas in the tank to get to Orange County, most women will operate on an empty cup or half a tank of gas and drag themselves through life. And so this is the finishing touches once you've healed your gut and helped your immune system and rebuilt some of your adrenal glands.
Now, one of the things that she points out is that there are many doctors, and I know a few of those, that will throw hormones, prescribe hormones to somebody knowingly has a bad diet. She says that's not going to work. You have to have the good diet that goes along with this.
I love the soil analogy. Like anything else, in order for any plant to take root and to grow nice and strong, we have to have good soil. And the thing is if your lifestyle is supportive to your hormonal balance, you will need to use less. You'll absorb those hormones better. Your body will know exactly what to do with them, and you just get more bang for your buck. It's more efficient, and then your life is better. So
the women I know on hormones swear by them. They love it. They feel better. They can't even describe how good they feel.
Well, and a lot of times, women unnecessarily beat themselves up for extra weight or for feeling like they're looking older and they're too tired to do anything about it. And we've all been in situations in life where we're just too tired. We know what we should do, but we're just trying to get through the day. And so I think sometimes if you can get treated with some of these hormones, get that lift that you need, then your lifestyle can come even after that because you're finally feeling up for grocery shopping and cooking and exercising and the things that you enjoy doing.
Now, you have a book in every bookstore about fertility, right?
Right.
And I want to get you to interview her more about hormones and fertility, like what's safe, what's not safe.
Yeah. So,
what do you know about that? Because I know you've talked to her a little bit about that.
well, you know, in our book, and we basically have a 3-month or a 90-day plan called a preconception cleanse and detox, and how to conceive naturally. And we talk about the thyroid and how important that is, and we talk about progesterone and how important that is. But my question to her that I want to bring her back on is, a lot of women have low testosterone and they never do anything about it. They're afraid to do anything about it because they don't want it to mess with their fertility. And so my question is, what if a woman's already pregnant? They cannot take testosterone if you're already pregnant, and it's low, right? So they're gonna have a rougher first trimester. They're gonna be more tired. They're not gonna have a sex drive. That affects their relationship. So how can you safely build testosterone while pregnant? And that's gonna be a fascinating conversation.
It'll be nice. Well, listen, another good show. Great interview, by the way.
That was a lot of fun. I would love to have her back. She's a wealth of knowledge.
All right. You've been watching the Randy and Christa show. Christa, final comment about this?
Thanks for being here with us, you guys. And just know that you have to vet out your practitioner, and that this is the way healthcare has gone, is you need to understand what you're looking for to find the practitioner that can meet your needs. Thanks for being here, and we'll catch you next time.